Hi, this is Sangeeta Dhavla going to introduce you to the topic chronic fatigue syndrome. Have you ever seen a person who is incessantly feeling weak? Yes, we are going to talk about such personalities at length in our chapter. The main objective is to introduce the topic of chronic fatigue syndrome. Another objective also is to focus on the psychosocial aspects of chronic fatigue syndrome. What is chronic fatigue syndrome? Let us find out. Most of the adolescents are found to be victims of a condition called fatigue. In studies of teenagers, it was found that around 70% of them reported as they were feeling weak and sleepy during the day. In most instances, fatigue in adolescence is due to a deficit in the amount of sleep that the person needs. Accordingly, most adolescents sleep a lot on the weekends or catch up on sleep when they have a lot of time. It is found that most of the adolescents sleep more during the weekends when they have time to catch up for than they sleep during the weekdays when they have to juggle between a lot of activities. In some instances, however, fatigue can be due to medical or psychological causes. The key to evaluation of the adolescent with fatigue is to try to single out the causative factor, whether it is caused really because of the exertion he is being put to, or whether it is because there is a change in his schedule, or it has an organic cause, or it is because of some psychological disorders. The kind of symptoms that may be exhibited by these people may be similar, but getting down to the etiology becomes highly essential. The disorder of chronic fatigue syndrome is a complicated one. Why? Because it is characterized by extreme fatigue, and this fatigue cannot be explained because of any underlying medical condition. This fatigue will worsen in case of any mental or physical activity, but there is no improvement despite taking any amount of rest. This fatigue is not caused because of any kind of exertion that the person is going through. There are many theories that are put forth to explain the etiology of chronic fatigue syndrome. These explanations range from psychological stress to viral infections. A few of the researchers think that it is the psychological stress that is the main reason for chronic fatigue. There are a few others who opine that it is the viral infection that is the cause of the chronic fatigue syndrome. But if you want to have a concrete diagnosis of the condition, there is no singular test that can confirm and say, yes, this person is suffering from a chronic fatigue syndrome. It is just ruling out the factors one after another that will be able to help the practitioner come up with the final decision saying, yes, this person is suffering from chronic fatigue syndrome. What are the various symptoms of chronic fatigue syndrome? There are 8 symptoms and a central symptom which will help in identifying the existence of chronic fatigue syndrome. And what are these symptoms? They are fatigue, sore throat, unexplained muscle pain, headache of inexplicable nature, enlarged lymph nodes in the neck, sleep that does not give refreshment on waking up, extreme exhaustion that lasts for more than one day even after a lot of mental and physical exercise, and existence of piercing pain which moves slowly from one joint to other joint without giving any other kind of indications like swelling or redness. It may be noted that fatigue is a symptom which occurs along with various other biological disorders as well as psychological disorders too. What are the various diagnostic criteria that are employed by the experts in order to diagnose a person as suffering from chronic fatigue syndrome? This is a topic that has been talked about right from the 1980s. There is a consensus among researchers that this syndrome is characterized by the experience of chronic fatigue of definite nature, which is not substantially alleviated or reduced even after taking certain amount of rest. It is not because of any kind of exertion that the person has been put through, and it results in marked reduction in the social and occupational activity of the person. When the person is feeling weak constantly, he definitely will want to give up his work and take rest. Despite taking rest, he sees to his dismay that he is not feeling refreshed and energetic at all. Therefore, you see that chronic fatigue syndrome will also bring about a lot of reduction in social as well as occupational activities. Because of the weakness that he is experiencing, he will alienate himself from taking an active part in the social activities. Those people who are diagnosed with chronic fatigue syndrome are constantly on the search for cure. What do? They pursue a physical cause and they tend to get the conventional medicine. They take to alternative medicine. Then they look for self-help groups, and then they also search a lot on the internet to learn more about their kind of a condition. It is because of the nature of this disease that most of these chronic fatigue syndrome patients also suffer from depression. There have been different criteria put forth by experts from different countries. There were two main criteria that were mainly used in the US to diagnose people who are suffering from chronic fatigue syndrome. The first criteria suggests that the condition is unexplained, it is persistent even after taking significant time of rest, and it is not a condition that has come out of any ongoing exertion. Another criteria is that it is not substantially alleviated or reduced even after taking substantial amount of rest. So, there is a reduce in the level of efficiency that is exhibited in the social activities, occupational activities, and also educational and personal activities. The concurrent occurrence of 4 or more of the symptoms will ensure that a person is suffering from chronic fatigue syndrome. Now, what are these conditions? He needs to be suffering from sore throat, be having tender lymph nodes, muscle pain, feel unrefreshed even after sleeping. There is substantial impairment of short term memory or even concentration. There is multi-joint pain, and there is post exertional malaise that lasts for more than 24 hours. Well, that is the kind of diagnosis criteria that the researchers from US look at. However, there are a different set of criteria put forth by the researchers in New Zealand. They call it the McKinsey criteria. And what does the McKinsey criteria say? They say that it is an illness duration of greater than 6 months. The person needs to be fatigued for more than 6 months. Only then can they categorize his condition as chronic fatigue syndrome. The symptoms should include chronic fatigue, muscle pain, and early muscle weakness even after exercise. There has to be a relapse of the condition. When the condition keeps visiting now and then, only will they be able to ascertain that it is a case of chronic fatigue syndrome. Chronic fatigue syndrome is a condition that anybody who is aged between 16 to 60 can fall prey to. Well, these are the criteria that the researchers from New Zealand look into in order to ascertain that in order to diagnose a person as suffering from chronic fatigue syndrome. Looking at the work that is put forth by the Australians, they opine that this fatigue has to be chronic, it has to be persisting, and also has to be relapsing in nature for them to decide or diagnose the person as suffering from chronic fatigue syndrome. These symptoms should be present for more than 6 months. There should be a neuropsychiatric dysfunction which includes impairment of concentration, that is evidenced by difficulty in completing mental tasks which were accomplished very easily before the person fell prey to this chronic fatigue syndrome. There is no alternative diagnosis reached by history, physical examination or investigation during this 6-month period. Well, those were the criteria that the Americans used, New Zealanders used, Australian used. Now, what are the criteria that the experts from UK look into in order to diagnose a person as suffering from chronic fatigue syndrome? This syndrome can be characterized by a definite onset that is not lifelong, and fatigue as the main symptom, fatigue which is severe, it is disabling and has effects on the physical as well as mental functioning of the person. Fatigue which has been present for a minimum of 6 months, and other symptoms also may be present, particularly disturbances in mood as well as in sleep. Specific exclusion criteria included that an established medical condition is known to produce severe fatigue, and a current diagnosis of schizophrenia, manic depression, substance abuse, eating disorder have already been diagnosed in the person. So, if a person is already diagnosed of some other kind of a disease, or if the person is suffering from substance abuse or eating disorder, fatigue is a common symptom. So, you need to ascertain that if this patient falls under any of these categories, if so, we will eliminate him from chronic fatigue syndrome. But if there are no such underlying causes, then he can seriously be considered as a strong case for chronic fatigue syndrome. What are the causes of fatigue? Researchers have not been able to identify the exact etiology of chronic fatigue syndrome. This may be a mix of various factors which affect those people who are predisposed with this disorder. Here are a few conditions that may trigger off the chronic fatigue syndrome. First, it may be because of viral infections. Viral fevers are very popular to leave the person drained out of energy. So, probably it is a case of viral infection that has triggered off the condition called chronic fatigue syndrome. Then there are the hormonal imbalances. The abnormal hormonal levels that are in the blood are produced in the pituitary gland, the hypothalamus and the adrenal gland. These hormonal levels may be responsible for chronic fatigue syndrome. Another triggering factor could be the immune system problem. When people have a slightly impaired immune system, they get more prone to developing chronic fatigue syndrome. What are the various risk factors involved with chronic fatigue syndrome? Age. This condition is believed to occur at any point in time of a person's lifespan. There is no specific category that only a 40+ individual is more prone to the disease or a 60+ individual is more prone to the disease. Sex. Women are more prone to chronic fatigue syndrome when compared to their male counterparts. This could be probably because of the hormonal changes that take place more rapidly in women than they take place in men. Lifestyle is yet another factor that makes a person more prone to chronic fatigue syndrome. People who spend a sedentary kind of a lifestyle are more prone to falling prey to chronic fatigue syndrome when compared to others who lead a very active life. What are the various complications that may come in with chronic fatigue syndrome? One blatant complication would be depression. This person has to cut off his occupational activities, he has to cut off his social activities. When there is limited amount of interaction with his peers, with his colleagues, there is a sense of losing his own self, and because of this feeling he feels more depressed. There are quite a number of lifestyle restrictions. Once chronic fatigue syndrome has set in, he will not feel up to the energy levels to go out frequently as he used to do earlier. So, his lifestyle activities face a huge halt. Social isolation. Because of this condition, he secludes himself from groups, he excuses himself from social gatherings. As a result, over a passage of time, he will naturally be eliminated from any get-togethers or any kind of social activities. As a result again of this condition, there is increased absence from the workplace. The symptoms of chronic fatigue syndrome mimic various other health conditions as well, and hence one needs to exercise patience while trying to diagnose the condition. It is very much essential for the doctor that he rules out other possibilities, he gets down to the real cause of this condition. One thing he should remember that chronic fatigue may also be caused because of sleep disorders. This syndrome may be a cause of existing disorders caused due to lack of sleep. It is essential that the doctor rules out the possibilities of other illnesses when he is trying to diagnose the condition. Chronic fatigue may be caused when there are sleep disorders in the person, when the person is suffering from a condition called hypothyroidism. The main symptoms of hypothyroidism are weakness, lethargy, apathy, forgetfulness, depression. So, these symptoms definitely overlap with the symptoms that are part of chronic fatigue syndrome. The doctor should exercise patience when he is trying to diagnose the condition of the patient. In addition to the ones that we have spoken about just now, there are some other conditions like anorexia, altitude sickness, which will contribute greatly to fatigue. Therefore, when the diagnosis is being done, a whole lot of factors need to be considered by the expert, and then only a final decision be arrived at. Once the diagnosis has been made in the right direction, the doctor will be able to make the right kind of treatment choice also. What is the treatment that is offered to a person who is suffering from chronic fatigue syndrome? A person who is suffering from chronic fatigue syndrome will get into depression because he feels extremely miserable and lost all the time. So, rather than treating the physical disorders, rather than treating the physical conditions, it becomes essential to take his feelings into consideration. So, when you are taking the feelings into consideration, it is the psychological aspect and the psychological help that becomes of paramount importance. He may be taught ways in which he can deal with his depression. He may be taught ways in which he can deal with the frustration that has become a part of his life now. He should be explained well in advance that chronic fatigue syndrome is a case that has no strong etiology, and the cause is really mysterious, and there is no concrete cure to this particular disorder. There are of course different treatment methods that will help him overcome his condition. One such method is the psychodynamic therapy, where it is found to help identification of the problem and then helping the person heal with the kind of emotional conflicts that he is experiencing because of the condition. The main reason for his frustration are identified. The main reasons for depression are identified, and the past experiences are taken into consideration. And when his unconscious resentment is targeted, the person will slowly talk about his resentments and then will learn to come out of it with some kind of support and psychological help. Cognitive behavior therapy and hypnosis also are found to be effective in tackling chronic fatigue syndrome. He will be taught techniques of relaxation. This will definitely help in overcoming the kind of frustration and stress the person is experiencing because of chronic fatigue syndrome. Cognitive behavior therapy basically focuses on managing the symptoms and also challenging the beliefs that the patient has developed about his own self and his own condition. Then we have the graded exercise therapy, which encourages the patient to become physically active. Then there is the physical therapist who will be able to determine the kind of exercises that are perfect for this kind of a patient to perform, so that he will regain his lost levels of physical fitness as well as activity. Chronic fatigue syndrome will push the person into lethargy. Lethargy means less amount of activity. This person who has remained inactive for a very long period of time should be made active in a very slow and steady process. It is not that he is made to do rigorous exercise from day one itself. Probably he can start off with small stretching exercises initially and then go on to intensify the duration or the kind of exercises that he needs to perform. By doing so, the strength and endurance levels of the person will improve and the intensity of the exercise can be increased over a period of time. It is true that chronic fatigue syndrome can be addressed very well when the psychological aspect is taken into consideration. At the same time, one should also look at the physical aspect. When a person comes to the doctor saying he is experiencing fatigue for long periods of time, he needs to take a whole lot of criteria into consideration and only then diagnose it as purely a psychophysiological disorder rather than jump to conclusions at the very outset. Now, what is the importance of naming this illness? Chronic fatigue syndrome has numerous names. It is a syndrome that is chiefly characterized by a myriad range of symptoms like weakness, fatigue, joint and muscle pain, concentration problems, memory difficulties, and also most importantly difficulty in sleeping. So, when treatment is aimed at the patient, it is the patient who is most important in trying to bring himself out of the condition. The patient-centered care requires immediate attention. The patient needs to be treated with greatest threat that he is experiencing, and isolation can be really threatening to a person. The patient needs to be assured that the problem has been recognized and there is certainly a way they can find out in which he can be brought out of. The lack of definitive diagnosis should not cause any impediment in the treatment process. When lifestyle changes are made, the person will definitely be able to make better adjustment to his condition. He should see to it that there are low levels of stress around him, and he should also improve on his sleeping habits. Again, pacing himself is extremely important in trying to deal with the condition called chronic fatigue syndrome. There are quite a number of alternative medicines available too to tackle this disease called chronic fatigue syndrome, but identifying the most singular, most successful form of treatment is the main challenging factor both for the doctor as well as for the patient. Like the disorder itself, it is difficult to ascertain which of the therapies will work best for the person. So, this is mainly because the symptoms of chronic fatigue syndrome are linked to mood, and these moods differ from one day to another. To conclude, chronic fatigue syndrome is a complicated disorder where challenges are faced both by the doctor as well as the patient. Ruling out or a step-centered approach will definitely help in overcoming the hurdles that are experienced in chronic fatigue syndrome. The person can definitely be helped to enjoy a better quality of life with the right kind of treatment approach and the support system that is trying to help him tackle the disease chronic fatigue syndrome.